Hello to all of you men out there. My name is Hina Sheth. I am a pelvic floor physical therapist here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And my colleagues and I here at Rebalance, we specialize in treating issues with the pelvic floor, and especially pelvic floor issues in men. And so many of you guys who are dealing with this issue are probably wondering what is going on. Now, are any of you dealing with issues of performance in the bedroom, and that's also possibly now or is in addition accompanied with pain down there? And how do I know this? Like, how am I creating a video about this? Well, because we've been treating men for probably 21 years now, and we specifically are treating men with pelvic pain issues, okay? So meaning pain down in the saddle region. But with many of our men, we've noticed that sometimes the issue actually, there were other issues that accompanied this pain previously to the pain starting. And so some men have actually said, hey, I've had erectile dysfunction for a while and I'm not sure what was going on. Some of you men might be really young and you're wondering like, wow, I'm young and I'm fit and I shouldn't have any problems in the bedroom, but you are. And have some of you gone to a urologist or some other wellness or medical specialist to try and get these questions answered? And what you're being told is maybe you've got some type of neurologic condition. Do you have ADHD? Maybe you have depression. Maybe there's something else along that line that's going on. But you may feel like, that doesn't sound like me. I don't feel like I'm depressed. I don't feel like I have ADHD. I don't feel like it's these other things that they're telling me. Or have you seen that these wellness or medical providers have also said, we're not really sure what this is. And so you're kind of like, just kind of stuck and you're like, I'm not really sure what's going on. Now, a couple of patients that we've seen have said like, this is what initially started when they were younger. They were having, watching a lot of videos, computer screens with erotic things on them so that they could then kind of self-stimulate. And they did this often. And what they noticed then is they can't perform in the bedroom. Now, years later, what starts to happen is some, not all, but some of you guys may have now started developing really weird symptoms down in your perineum. Either penile pain, scrotal pain, lower abdominal pain, testicular issues, maybe rectal pain, pain with sitting, urinary frequency, urgency. Some of you guys may have actually started feeling these symptoms. And then you go back to your urologist or your medical provider and they're like, well, we're not really sure what it is. Maybe sometimes you've been put on antibiotics because they thought it had something to do with some type of inflammation or infection, but really there was nothing there. Now, maybe chances are that someone or one of the medical providers maybe said, well, maybe this is a muscle issue. So here we are. So hopefully some roundabout way you guys have found this video. So if you are, because we're pelvic floor therapists and we specialize in muscles called the pelvic floor, which I'm going to show you in a minute, this is what we specialize in. So the pain component of this is where we come and we can really help with what is going on. And what typically happens in some men, not all men, but if some of this pain was possibly accompanied because of excessive masturbation or things like that, then what could be happening is over time, because of these muscles spasming over and over and over and over again, you kind of can develop almost like fatigue of these muscles. And when that happens, you can develop issues in the muscles of this pelvic floor. Now, this pelvic floor model, because it's hard to come by a male pelvic floor model, this is actually a female. But I want you to pretend that this is where the penis actually comes out of. And otherwise, the anatomy is pretty much the same. So just imagine that all of these muscles are contracting and relaxing and contracting and relaxing over and over and over again every single time you guys have ejaculation. And when that happens, this can then be accompanied by these muscles basically spasming, becoming tight, becoming fatigued, and then it actually starts to affect a lot of different things. It gives you pain because there's nerves that run through this area. These nerves can become basically irritated and painful. And then also, it can actually cause physical changes as well, where some of you may be dealing with something where, you know, the penis has actually changed. It's smaller, it's harder, it doesn't feel the same. And this can be called something termed hard flaccid. So that then you develop, you're like, why is the texture so different? Why is it harder and not, you know, but it's small, it's not really erect. So there's all these things that can accompany fatigue of these muscles. And then that can lead to just all sorts of issues that sometimes can feed into the urinary changes like frequency, urgency, things like that. And then all sorts of other like lower abdominal pain, gluteal pain, scrotal pain, testicular pain, all that kind of stuff. Now, for some of you men, that may not be how it started. You may have actually had pain that started first, and then due to the pain being present, now perhaps some of you have been on medications, maybe some of you haven't, but now this has actually changed your ability to perform in the bedroom because you've actually had this pain going on in these muscles. So what do you do about it? And how do I know that this is the problem? Well, I will tell you, we've been treating men for 21 years now, all myself as well as my colleagues. We treat, probably at this point, we've probably treated thousands of people. And this is what we see. And this is what we specialize in. And most physicians don't even realize that this is the problem. It's actually a muscle problem. How crazy does that sound? This is a muscle problem, and a doctor has a hard time figuring out what is going on. And I'm not saying all doctors, because there are some great doctors out there that really understand this. But I would say for as many great doctors there are, there's thousands of other doctors that have no idea what is going on. So I wanted to create this video because my job is to educate the public about these conditions because it's so taboo. People don't want to talk about them. You don't want to, it's an embarrassing issue. You probably don't want to have this conversation over, you know, a cocktail or a drink with your friends. It's not something that men talk about with each other. But I know that it's probably a relief that you're hearing this, that, wow, this is actually a problem and it might be fixable. Actually, it can be very fixable. But the pain part of it that you have going on is something that we can actually really help with. Because now, I've been doing YouTube videos for a couple of years now, so I'm sure some of you have watched a bunch of my other ones, and some of this might be repetitive information. But recently, we created an online program to actually help to start treating all these musculoskeletal and pelvic issues or pelvic floor issues so you can start getting that under control to really reduce pain, to reduce the spasming that you're having, and to start getting you much more comfortable, if not pain-free. And hopefully that's going to put you back on the right track of hopefully eventually performing in the bedroom. And the whole performance issue is a whole nother video that I'll possibly end up doing, but you may want to check out some other YouTube videos that actually talk about, there's actually a TED Talk that actually talks about issues with erectile dysfunction and performance in the bedroom due to excessive ejaculation. And so you may want to check that out because that will actually talk to you a little bit about the neurophysiology and how things like that actually change the brain. But my goal for this video was to actually make the connection of this erectile dysfunction and inability to perform in the bedroom with the fact that you also have a pain component and they can kind of interchange with each other. So the pain can lead to performance issues, but also performance issues due to some of these other things can actually lead to pain. And so there is a solution for the pain piece of this that is really important. So I'm sure some of you are wondering, like, stop talking, just tell me what I need to do. So basically down in the information box underneath this video, if you click on the little arrow below, and of course subscribe to us, because every time I put out new videos, you'll kind of get updates on them. But if you look down on that link, there is a link that basically says male pelvic pain solution. And even if you decide, hey, I don't want to purchase the program, which is actually ridiculously cheap considering how much information you get. But even if you decide that you do not want to buy the program, there is I want to say 30 to 40 minute PowerPoint that I actually go through, which is extremely powerful and empowering so that you really understand how to get this under control. Even if you don't even end up purchasing the program, I think it's really important for you to at least watch the PowerPoint so you really start to understand this condition and what might be going on, so that when you do end up hopefully seeing somebody for this condition, and maybe you don't, because really a lot of this could be solved with doing the therapy that's actually in this program. But even if you decide to kind of talk to a healthcare provider, you actually have the understanding of this knowledge, and that's going to make you just much more you're going to be taken much more seriously, first of all, and then you're just going to feel quite a bit empowered to really be your own advocate. So good luck to all of you men out there, and I hope to see you as part of our program. Talk to you soon. Have a great, amazing day.